Congratulations, you just had your knee replaced. We're really excited to join you on your journey towards rehabilitation of your knee after your knee replacement. You've been on a hero's journey with us. Before your knee replacement, you probably had a lot of apprehension about doing the surgery, and now that you're on the other side of it, we're really excited to work with you to help you know what your goals are week by week, what you can expect, and some exercises that you can do at home to make sure you optimize your recovery. And as with every surgery, make sure you check with your surgeon before you do this or any activity. We're here to tell you what to expect the first week after your knee replacement surgery, what you can expect, what the goals are, and how you can make sure that you're going to optimize your recovery. First and foremost, you want to make sure week one, you're going to expect to have some swelling around the knee. You're probably also wearing what's called a TED hose. A TED hose actually helps control the swelling and inflammation around your brand new knee. Most surgeons will recommend that you wear that for a period of 2 weeks while your knee heals, but please check with your surgeon and make sure that that's their protocol. So the first week, the goals are control the inflammation. By controlling the inflammation, you're going to be able to control the pain that you're having and increase the effectiveness of your healing and the time that your body is going to take to heal. The way that you do that is with something called ice, also known as cryotherapy. Cryotherapy is a generic term to describe any type of heat or ice modality, but when you have your knee replacement, the most important thing in the first few days is make sure you're icing as much as you can. The second goal for the first week is starting to regain your range of motion and the distance that you can ambulate with assistance. First 48 hours out, you'll be using a walker to ambulate or crutches, but most of the time a walker is actually more recommended for knee replacement surgery. And you want to keep track of every day, keep track of how far you're going. The first week, we want to see you at about 25 to 100 feet walking with assistance. The last but not least, and probably the most important, is making sure that you don't get a DVT. What is a DVT, Ashley?
Deep vein thrombosis.
Yeah, also known as a blood clot. So the way to prevent blood clots is actually by moving. So even when you're not up and around doing your exercises, if you're just laying in bed resting or you have your knee elevated, it's really important that you move your foot up and down to prevent that from happening. That will help pump the calf muscle and pump the blood back up to your heart and keep that blood circulating. So what are the signs and symptoms of a DVT, a deep vein thrombosis? Redness in the calf and swelling. So a lot of swelling, pain, inflammation. You'll notice that redness will start to travel up your leg into your thigh and into the back of your hamstring as well. And those are things to look for. If you notice anything like that, immediately call your doctor. So when is it appropriate to call the office?
It's going to be appropriate to call the office if you're holding a fever of 100.4 for over 24 hours. If you're having persistent bleeding coming from the incision, persistent numbness that doesn't go away with elevation, any sort of redness and swelling in the calf that isn't going away with elevation, compression, or ice.
And that's it. Week one is really all about your range of motion, flexion and extension. The first exercise that you're going to do, we're going to use Ashley's right knee as an example. So pretend that Ashley had right knee replacement. You're going to sit on a chair with your foot on the floor, your feet and your heels and your toes on the floor. And what you're going to do is bring your heel back, keeping your toes nice and straight, bring your heel back towards the chair. And that is flexion. So ideally by week one, we want you at 90 degrees of flexion. That will help prevent the scar tissue from forming. Now, if you want to make this a little bit more difficult and challenge yourself a little bit, you can put a very heavy book in front of your foot and then scoot forward on the chair. This will increase the flexion angle a little bit more of your knee and give you a little more push on that range of motion. Now, you don't want to go past about a 6 or so on your pain level. So if you're starting to get a little bit increase in your pain, that's normal, but try to keep it around a 6 or 7 at the most. And you're going to want to hold that position for 2 minutes. and then you can go ahead and slide back. We're going to show you one more exercise that we want to do, and you're going to want to do these for a total of 2 hours a day for the first week or so. So first thing is flexion, and next we're going to show you extension of your knee. All right, so for the next exercise for week 1 is extension. As we mentioned, the 2 most important things this week are flexion and extension. We want healthy scar tissue for sure, but we want to make sure that it's not being formed that's going to restrict your range of motion in the future. So again, we're using Ashley's right knee as an example. When you first do this exercise, your knee is going to be naturally in a little bit of a flexed angle. What you're going to want to do is work on extending that knee out and straightening it as much as you can. Now you are going to feel discomfort with this exercise, especially behind your knee. It's not going to feel comfortable. This is an exercise that you're going to have to push through. You are going to experience pain. That's normal. It's very, very important that you push through the pain this exercise. Again, try not to get, so that you're off the charts in pain above a 9 or a 10. We want to keep it within a reasonable degree of pain, but make sure that you're working kind of through that. So you're going to want to get this knee into extension as much as you can. Hold that for 2 minutes, and then go ahead and just give yourself a little bit of a rest. So you're going to want to do these 2 basic exercises, 2 minutes for up to 2 hours every day for the first week.